Good afternoon. Thank you all for being here today. Sorry that I missed you yesterday. I know that you missed me as much as I missed you, but I was unable to be here due to a prior commitment that I felt was very important to the people of Mississippi, that we participate on the White House call with the President and the First Lady, the Vice President, and the entire coronavirus task force. We did get some additional information. We were able to update them on what we're doing in each and every state, certainly what we're doing in Mississippi, and I think it's fair to say that they were very pleased with our 14-day plan to test in nursing homes. We are continuing to see new cases in our state. We know for a fact that that this is not over. The threat is not gone. It is still here. We still have to be diligent. We still have to be smart. We also have to realize that we have 220,000 Mississippians that have filed for unemployment, and therefore it is critically important that we continue to work to reopen our economy, but to do so in a safe, responsible way. I am committed to that. We now have 11,704 cases, I believe, as reported on the State Department of Health website. But as you probably know, on each Monday, the department also now lists total number of recoveries. In Mississippi, we now have 7,681 recoveries in our state, and with 554 tragic deaths, we continue to have approximately 3,400 active cases in our state. We have more work to do, but I completely am convinced that we are much better served for you to be responsible, for you to do the right thing, to protecting yourselves and protecting your neighbors, and we can do far more with personal responsibility than we can do with government mandates. Having said that, I also think it's important that we as leaders in our state work with Dr. Dobbs and his team and the public health experts so that we can lay out guidelines for individuals and for institutions to follow those guidelines. And today, I'm extremely excited to share some further progress with respect to guidelines that are coming out. We are putting out guidelines today to help our churches safely return eventually to in-person services. But first, I want to remind everyone that in our state, churches were never shut down. It was important to protect our freedom of religion. It was important to recognize that it's a slippery slope when government starts telling our religious institutions that they cannot meet. However, what I did do, and I did it because I believe in protecting the public health and the safety of Mississippians, is I did reach out to our pastors. I reached out to our churchgoers. I have been asking them to do the right thing. And what I want you to hear me say today is I am incredibly proud of our pastors. I am incredibly proud of our churchgoers. I'm incredibly proud that you have been patient and that you have been smart. I know that you want to do the right thing, and I know that our pastors want to protect their flock. We're putting out guidelines today to help these pastors determine a safe path forward. We'll be putting out a document that will be on our website and will be delivered to media outlets that will provide quite a number of pages of guidelines. Some of the most impactful ones include deep cleaning your churches to ensure safety. Consider holding services just for the most vulnerable populations so that they can avoid interacting with larger crowds. Consider limiting your attendance and providing space between non-household units. Replace choirs with solo performers. I want to say that again. Replacing choirs with solo performers. We know that early on in this battle, we saw a number of community transmissions that occurred from various choir members that had the virus, spreading it to other choir members. Please be mindful of either spreading the choir out or just doing soloist. Avoid passing offering plates. Obviously, as you pass the offering plate from one person to the next and every single person touches the same offering plate, you increase the risk of the spread of virus. There is a way to take up an offering without doing that. We're also going to recommend that if you have coffee stations or other amenities within your church, to consider closing them for the time being. Again, these are guidelines. I would encourage you to consider waiting at least another week or two, perhaps to June the 1st, before you start instituting these guidelines. And I will say this as a personal point. My family is likely going to continue worshiping from home. I plan to continue doing our morning prayer service on Sunday mornings into the foreseeable future. I believe in my heart that our church is not a building. We can honor our Lord and still keep our neighbors safe. You don't have to rush back. We do want to provide a playbook for the best way to do it as safely as possible, but we want our pastors to determine when that time is right. I can't thank you, the people of Mississippi, enough. Over the last several days, I've reflected on the sacrifices that you have made, and it does me great good to know the way in which the people of this state have acted. When we asked you to be smart, you chose to be smart. When we asked you to socially distance, you chose to socially distance. Because of that, Mississippi has flattened the curve. But the risk is not over. We have to continue to be mindful. We have to continue to be smart. We have to continue to socially distance, whether we're in church or at work or somewhere in between. We have to continue to fight this invisible enemy. We know that COVID-19 remains in communities throughout our state. We know that it is worse in some communities than in others, but we know that it is in all of our communities. Because of that, I have to continue to ask you to be diligent, to be smart, to follow the guidelines that we have put out. Whether it's an executive order that carries the mandate of law or simply recommendations and guidelines, I have to ask you to continue to be smart, protect yourself, protect your family, and protect your fellow Mississippians. With that, I'm going to turn it over to Dr. Dobbs and let him give us an update on cases. Dr. Dobbs?
Thank you, Governor. Just as an update on some of our key public health guidance, I just want to remind everyone that coronavirus is actively circulating in our communities and everyone is still at risk. And coronavirus, although more dangerous for older folks and people with chronic medical issues, is dangerous for everyone. Most people spreading coronavirus don't even know they have it. It's impossible to know for sure if someone you're around has coronavirus, so you must assume that everyone you encounter in the public could possibly be contagious with coronavirus. Social distancing and masks can prevent coronavirus transmission. So just as a reminder, please continue to maintain social distancing, minimize trips out into public, and when you are in public, please always wear a mask. And even though some businesses are required to wear masks as part of their operation, public health guidance is that everyone wear a mask when you're around other folks, even if you're in a different business where it's not mandated. It's the right thing to do if you want to protect yourself, protect your family, protect your community. So please, continue these social distancing measures and wear a mask in public. As far as new cases reported, we are reporting 272 new cases, 27 deaths, which is quite a large number of deaths for a single day. None of those are retrospective looks on vital statistics or death certificates. It's all new cases that were recently received. 15 of those deaths were in long-term care settings. We continue to have significant issue in long-term care settings, as you're well aware. We have 98 active outbreaks in nursing homes that we're working with, and we're also aggressively testing, as the governor discussed earlier, every single nursing home in the state, planning to check every single patient and every single employee. We will continue to work aggressively with long-term care. I know that there's been a lot of interest in the Department of Health releasing specific nursing home names, but I just want to reinforce that it's really a privacy issue, and a resident of a nursing home, that is their address. That's where they live. We've always had the stance that we wouldn't release protected health information, just like a syphilis patient, we wouldn't post their address where they live. So it's a privacy issue. We fully respect the open records laws. It's simply a privacy issue, although I know we'll be talking about more of this in the future. As far as testing goes, we've tested a total of 117,760 patients to date. We have several testing locations in addition to the standard ones. Obviously, we always have one going on most days at the Mississippi Fairgrounds with UMC running that one. We have one today at Bogahoma and then one at Oakland in Yalobusha. Tomorrow we'll be in Columbus, Thursday in Collins, and Friday in Mendenhall. So please get tested if you have any symptoms of coronavirus or if you think you might have been exposed. And then the last thing I do want to mention, we had a couple of issues with children. We are reporting our first case of multi-system inflammatory syndrome in children. That's the new acronym MIS-C. The child was from Central Mississippi, who tested positive coronavirus, but he has recovered and been discharged from the hospital. We'll be monitoring this very closely. Additionally, sadly, we are reporting a pediatric flu death. It's our first pediatric flu death for 2020. Again, a child from Central Mississippi. The child tested negative for coronavirus. A powerful reminder that flu's out there. Even in the summer, we do have flu cases, and how important it is to get your flu shot. And Governor, that's all I have for today.
Thank you, Dr. Dobbs. The effort to test everyone in long-term care facilities, as well as not only the residents but also the employees, is one that is ongoing. We started this late last week. Just so you understand the real deal that this is, we have approximately 28,000 total residents plus total employees. We've tested 40,000 Mississippians per 1 million residents. We've done approximately 120,000 total tests, and our goal is to test almost 27,000 in long-term care facilities over a 14-day period. And we're not halfway through that, but we've already started that process. And so Dr. Dobbs and his team, the Mississippi National Guard, the Mississippi Emergency Management Agency, are teaming up to do that. We're giving the long-term care facilities the opportunity, if they want to do it themselves, that's perfectly acceptable. That's one of the options that we have given them. If they want us to do it, if they want the Department of Health to come in, we're willing to do that as well. But as we see more and more of our deaths, and you can see this each day, the percentage of overall deaths that have occurred in Mississippi, every single one of them is tragic, but the percentage of overall deaths in Mississippi has continued to creep up in long-term care facilities as a percentage of overall deaths. And therefore, we've got to understand that while we are seeing transmission throughout our communities in terms of the number of deaths, long-term care facilities is certainly one of the high-risk areas, and we were committed to working through that. With that, I'm going to turn it over to Director Michelle, who's going to give us an update on the emergency management side of things.
Thank you, Governor. Today had a meeting with the Mississippi Department of Transportation with regard to contraflow in our initial planning for hurricane season. As everyone should be aware, we've had our first storm, Tropical Storm Arthur, off the East Coast. Fortunately for us, that did not have any effect on Mississippi, but it was a stark reminder that hurricane season has officially started almost 3 weeks early this year. Just a reminder about contraflow. Should contraflow be activated this year for hurricane season, that is a last resort only. It is an agreement between the state of Louisiana and the state of Mississippi. Just a few things to remind everyone. Again, as I've already said, it's a last resort. You should only use that if you have to. You should prepare to be involved. The contraflow would be open and operational for only a period of about 12 hours. That typically is going to be basically a very long traffic jam because, again, it's a last-minute effort for people to get out. So you want to plan ahead to avoid having to get involved in contraflow. There will be no fuel resupply or refuel points along the contraflow route other than those exits that will be available once the contraflow ends. So your vehicles will need to be full of fuel on your way. If not, then you'll be stranded along the route and then have to be evacuated off. So there's a lot of factors that go into contraflow. This was our initial call. We'll be speaking with the Louisiana Department of Transportation on Thursday, as well as MDOT, to have future coordinations with that, but that's just a reminder. Crisis counseling was a large topic of conversation last night for the governor on his call with the president and first lady last night. Under our individual assistance benefits that we have under the COVID-19 disaster, we certainly understand that COVID has taken a toll on Mississippians financially, physically, and mentally. And as such, stress, anxiety, and other stress factors are typical symptoms during a disaster such as this. There is a hotline that is available for victims if you're needing to talk with someone during COVID-19, if you're feeling overwhelmed or alone. That number is 1-800-985-5990, or you can text TALK with us to 66746. For Spanish-speaking Mississippians, can also call 1-800-985-5990 and press 2 to speak with a counselor fluent in Spanish. Or you can also text Hablanos to 66746. So that crisis counseling is paid benefit through FEMA and available for anyone that needs to speak with someone at this time. Decoration update. The IA decoration for the Easter tornado, we're up to 2,181 applicants for benefits that have been approved in the amount of $2.8 million. The disaster assistance centers that we have available that we opened up at those 6 counties, we extended those for one more week. They will be closing this Friday at 5 p.m. So if you're needing that face-to-face interaction, you'll need to get to those centers before Friday at 5 p.m. And then finally, we're still waiting to hear back from FEMA on approving the addition of the 26 counties for the public assistance declaration for that same Easter tornado disaster. And then finally, just PPE. We continue to push PPE out every day. Yesterday, we delivered to 28 Tier 1 facilities. That included 4 facilities in 4 counties that needed emergent resupply. And then today, we're delivering to the 82 counties in the Mississippi Band of Choctaw Indians. Governor, that concludes my update, sir.
Thank you, Director Michelle. Thank you, Dr. Dobbs. Both of you continue to do incredible work, working around the clock. Your teams are the best of Mississippians. We're so proud of everything that they've done. A reminder, 1-800-985-5990. If you are having trouble and you need to talk to someone, much of our conversation with the President and First Lady Melania yesterday was surrounding Melania's effort and recognition that times are tough in America. Times are tough right now in Mississippi. If you are one of the 220,000 Mississippians that have lost your job, it's hard. Many of those individuals have not ever been on government assistance, and now for the first time ever, they find themselves on government assistance. The fact is that we need to be there for our friends and our neighbors. Mississippians are the most generous people in all of the world. I believe that with all of my heart. We need to reach out and help our friends and our neighbors. We need to recognize the toll financially, mentally, and otherwise that this COVID-19 has had in our state and in our nation. And we need to come together as a people. We need to put all of our differences aside and do everything that we can as good, decent, hardworking Mississippians to help our friends and help our neighbors. Questions? Courtney Ann?
A week or so ago, you had said, look, don't expect a big announcement regarding churches because of the fact that none of the orders have closed them. Can you talk about the decision-making and saying, maybe we do need to put out some specific, and it looks like very specific guidelines about what resuming those services may look like? Was it just because so many did reach out to say, we need some guidance?
You know, I will tell you that throughout my political career, I have been so blessed to meet so many in the faith community. Pastors who personally reach out to me over the last several months that I've known through the years. I've been in virtually every community throughout Mississippi. There are some real disadvantages to election years, but there are some real advantages as well. And one of those advantages is if you work hard enough and you try to see the people, you meet pastors throughout the entire state. I've had that privilege, and many of them reach out to me personally over the last several months. They've let me know. They've texted me. They said, we're praying for you repeatedly. And I can't tell you how much that means to me and how much that means to our family. But it has become clear to me over the last 4 to 5 days, even more so than before that our pastors really want guidance. They understand that we never shut them down, but they want to reopen. They want to do it smart, though. It is very clear to me that our leaders in our churches want to reopen, but they want to protect their friends and their neighbors. And the fact is, while some people across the state think they know more than the public health experts, our pastors know that if I as a leader, as a governor, can sit down with Dr. Dobbs and his team, and we can develop potential ways in which we can reduce the risk of spread in churches, that's the way our pastors want to open their churches. They want to do it responsibly. Most are not going to do it this weekend. Many are not going to do it the next weekend. And I think that makes sense. I think we should be looking for a couple of weeks out is when we reopen. But when we reopen, and that's a decision that's made by pastors because there is no government order that has shut them down, these are guidelines. And by the way, there are 8 pages of guidelines that can go through and talk about the things that can be done to minimize and mitigate the risk. We are not going to eliminate the risk in our churches. It's just reality. If you bring people back into confined spaces, there are going to be risk. And so what we're trying to do is to lay out guidelines for those individuals that want to reopen over the next several weeks. And in many instances, it's the leader of the denominations, whether it's the bishop of the Methodist Church or it's the superintendent of the United Pentecostals, both friends of mine, and the leader of the Baptist churches, et cetera. They're going to make decisions as well as a unit, but we just wanted to say if you want to reopen or when you reopen, here's one of the safest ways in which to do it. I'm reminded there was a question asked recently on a call that I was on with Dr. Burks, and the question was, if we do X, you can fill in the blank what X is, but if we do X, will it be safe? Her response, which I think is very appropriate here, is it will be safer if you do that, but in terms of us trying to get completely back to normal, we've got to understand that there are risks associated with any decisions that we make. And so what I'm trying to advise pastors of is, if you used to have one service with a couple hundred people, think about having 2 or 3 different services or 4 or 5 different services so that we can spread out the number of people in any one facility at any one time. Scott?
What if I could redirect Dobbs back to the MIS case, the multi-system case, and concern, of course, those things don't pop up in a bottle, that is there room for more concern about that case?
As far as that specific case, it is a treatable disease, and certainly I know the kid will get fantastic medical care going forward. We do have several others that we're monitoring and are possible cases. So I would expect to see more over the coming weeks.
Would that be a case that was brought in, perhaps that person traveled, came back, or just
not that I'm aware of?
It just developed?
Well, after getting coronavirus,
Yeah.
but I don't have any knowledge of travel history and stuff like that. Yes.
I understand.
Yes.
Dr. Dobbs, have you asked the Attorney General to give you an opinion on whether or not you can keep that information away concerning nursing homes away from the public?
We have an Attorney General assignee in our office, and we also have a privacy officer who is our HIPAA compliance officer. And this is protected health information, just like the name, just like the phone number. There's a list of 18 different identifiers that are protected health information, and the Department of Health, as a clinical provider, is a HIPAA protected entity. And unless there's a public health reason to release the information, and we haven't identified one as far as like any risk to the general population, like if we have a hepatitis A outbreak and a bunch of people eat there, y'all noticed before we released the name of the restaurant because people needed to know. And if there were a similar situation in a nursing home or anywhere else, we would do the same. But for a contained outbreak where we have, we're doing all the testing and stuff like that, and there's not a compelling public health interest, we consider the nursing home address that patient's address. And CMS sees it the same way. So it's the same stance we've had before. I have been asked that question by some of the attorneys from the AG's office, and that's exactly what our AG assignee attorney says, and our privacy officer. So it's just simply a privacy issue.
Renee?
Hugh Keaton with WLX has a question.
Great.
Hugh?
Hello, Governor. Thanks for taking our question. I have a two-part question for you. First of all, museums. When do you foresee allowing museums in the state to reopen? And also some clarification on bars that do not serve food. Do you feel like that it will be possible to allow bars that don't serve food to open if they practice the same guidelines that restaurants are practicing now?
Well, thank you, Hugh. I appreciate both of those questions. We are having conversations internally about both of those items. We're working with our partners at the State Department of Health to look at guidelines for both of those entities. We're at a phase now in our state where 97 to 98% of entities are open. Bars that do not serve food and museums are two of the few entities that are left. We are looking at ways in which to provide guidelines for those two entities, and I would anticipate that we would have the opportunity to propose guidelines on those entities, most likely over the next several days. Bob?
What about the bill? Are you close to signing it, or are you having second thoughts, or where does that stand?
I'm not having any second thoughts. I'm having first thoughts. But we're looking at it. Our legal team and our policy team continue to review the bill. They as they do on every single bill that passes the legislature, they'll provide recommendations to me. Obviously, the bill is due tomorrow, so we'll have more reason to discuss it once we get to tomorrow. So,
The 27 deaths and the 15 being long-term health care, you look at the numbers alone and go, ooh, that's a large number of deaths, and we're still seeing a large number of cases. Are we looking at the possibilities of stricter enforcement in other counties to try to stem this tide?
We've seen relative stability in cases. The deaths are sadly not that surprising, as we've seen it sort of move through the nursing homes and older people and susceptible individuals. So that's been something we've unfortunately anticipated. But if you look at our average number of cases for a state, we've seen relative stability. I mean, we really have. It's been pretty flat if you look at a rolling 5-day average, but it's not really gone down. And so this is just kind of where we are. We're still seeing a lot of cases, and that's why it's important for people to be vigilant. And I don't know, we have not made any recommendations to do anything more stringent at this time.
What is going to make it go down? I mean, y'all are opening up while it's still staying sort of the same level. I mean, what's going to drive it down if everything's opening back up?
Well, it may not go down. I mean, quite honestly, that's one of the reasons why it's so important. If everyone followed the guidelines, if everyone wore a mask in public, if everyone were cautious, it would absolutely go down, without a doubt. But people are eager to be normal, and we have a new normal. We have to embrace the new normal and find a way to live with this thing, because we're going to have cases, going forward as far as the eye can see until we get to the fall, when there's a really high likelihood that it's just going to skyrocket and we'll be having other challenges. So we just got to be prepared and make sure that we reinforce that message that people don't need to let their guard down. Not that we don't need to live, we just got to find a new way to live with this new reality.
let me just also add that the continuation of new cases is not something that is a surprise to those of us who have been in this fight from a public health perspective for the last however many months it has been. The goal of our policies has never been to completely eliminate the spread of the virus. I don't know how many times I have said that sitting here. Our goal has been as follows. If you are a Mississippian who can get better with quality care, that you have access and availability of receiving that care. Our goal has been to protect the integrity of our healthcare system. That's the reason very early on you saw us bring Dr. Brunson and Dr. Hayes in, so that if we did see the spike, which thank God we never saw the kind of spike that they saw in Louisiana. We never saw the kind of spike that they saw in New York and in New Jersey and in some of the northeastern states. What we're seeing now or saw in Detroit and now more in Illinois. We never saw that huge spike in cases. We were prepared for it if we did, but when you look at our hospitalization and you look at our number of patients with COVID-19 in ICUs, when you look at the number of COVID-19 positive patients on ventilators, it's been relatively flat for almost 40 days. And what we have to realize is that the virus is in every community. We have to be diligent. Dr. Dobbs' point, which is we need 100% participation in the smart policies that we are recommending or requiring in certain areas. We still have a shelter in place for those individuals that are over the age of 65, as well we should. This virus is particularly cruel to those in that category, those who have pre-existing conditions. You look at the number of fatalities. Sadly, but true, of the 500 plus fatalities, 80 of those are individuals over the age of 90. An additional 129 are individuals over the age of 80. An additional 155 are those over the age of 70. An additional 120 are those over the age of 60. It is those individuals that are particularly compromised from an immune system standpoint and those who are older that are most at risk. Everybody is at risk, but those are the ones that are most at risk. The reason that everyone is at risk is because some of us in society have pre-existing conditions that we don't even know that we have. It's just a fact. And so that's the reason everyone needs to be diligent. When you're out in public, you need to wear a mask. You need to be smart. We all want to get back to normal everyday life. But the normal today is different than the normal was 3 months ago. We can do things, but we have to understand that there are risks. Viruses such as the flu, they are spread from person to person, and this particular virus is clearly far more dangerous than many viruses that we've dealt with in the past.
Hugh with WLOX has another question. Hugh?
Yes. Governor, you continue using that number 220,000 unemployed, even though a lot of people have gone back to work over the last couple of weeks. Do you have an update on potentially how many people are no longer receiving unemployment benefits? And also a follow-up on that, the Scarlet Pearl employees were helping you take some calls. They're going back to work this week as the Scarlet Pearl and all casinos are opening in the near future. Are they still helping out the state?
Yes, the answer to your second question is that they are still helping out the state. The last report I received, they had taken over 6,000 phone calls. We are so blessed that the employees at the Scarlet Pearl have done what Mississippians do. They've stepped up and they've helped in a time of need. I personally appreciate what they have done. They're continuing to help. And I've even heard that they're thinking about, even when they open up, having a group of employees continue to help us as it relates to that. The 220,000 is the total number of individuals that have filed for unemployment insurance in the last 8 weeks. I do not have an update on exactly how many refiled. As you know, in Mississippi, state law requires that you refile on a weekly basis or at least re-update. I have not gotten that yet this week, but I will find that out and have that information readily available at tomorrow's 2:30 briefing. But that's a great question and one that we'll get an answer for. Courtney Ann.
Dr. Dobbs, you talked a good bit about masks today, and in so many of the press conferences, we continue to see so much misinformation on social media, particularly regarding masks. Claims running the gamut from it doesn't help protect from the virus traveling, it could reinfect you, it could just all the runs the gamut. Could you help explain to people the reasoning or the science even behind why it is important and what its purpose is?
All right. First off, it needs to cover your mouth and your nose, right? I see a lot of this. I'm sure y'all do too. Yeah, so, please cover your mouth and your nose. In the hospital environment for people with flu, we've always worn surgical masks to protect one another. So there's clear precedent for viral transmission. There's multiple reasons for wearing a mask. One of the most important reasons is because people don't know they're infectious, even if they have no symptoms, they're totally contaminating the air around them, kind of like Pigpen walking around with contaminated air, or the environment. And if you have a mask on, 90% of that doesn't get out. And so you're basically making an infected person walking around a lot less contagious. Keeps you from touching your face and also keeps you from breathing in, a good proportion of the infectious droplets that are floating in the air. So, it's very important. It also sends a nice psychological signal that say, hey, this is not normal. We need to stay away from one another. So it's such an easy thing to do. If I can go to the store and get my bike fixed but wear a mask, that's wonderful, versus closing all the bike stores, right? So it's just such an easy thing to do. Just really wish everybody would take it seriously.
Yeah, there's no doubt that we strongly encourage individual Mississippians to wear a mask. One of the, this whole process has been challenging for so many Mississippians, for all Mississippians, I would argue. But there's also been signs of inspiration. And one of the inspirational things that I've seen is just ladies sitting at home making masks and giving them away. I can think of 10 different people that I've personally spoken with that are doing just that. They're taking it and giving it to their fellow church members, taking it and giving it to the elderly in their church. That's what Mississippians do. That's what gives me great reason for optimism about our future, is that Mississippians are stepping up and helping each other. But if you can, please wear a mask.
Emily with AP has a question. Emily?
Thank you. Hi, Governor. What are the updated numbers for testing and number of positive and negative cases inside the prison system?
Okay, I was trying to come up with the fact that we have tested almost 40,000 per million, so we've tested almost exactly 120,000 Mississippians. But then those last three words made me go to my notes here, because I do have this as of early this morning. We had done 56 total tests of inmates. We have 20 positive cases, 35 negative cases amongst inmates. We have tested 53 staff members. We have 9 positive cases amongst staff, with 40 negatives and 4 pending. So we have 1 pending amongst inmates, 4 pending amongst MDOC staff, and we have tested 109 combined. Thank you, Emma. Scott.
Reservoir operations, the sandbars along the Pearl River. I don't know if there's a straight indication of whether people can resume boating in those areas and on the sandbars. There seems to be some gray area of what can and can't place, and can take place, and should it take place, where people can gather on the sandbars of the Pearl.
It's certainly not advisable for large groups to gather, even outdoors. One of the challenges that we had early on is that we had hundreds of people gathering. We believe that if you want to go to the beach or even a sandbar and stay 6 or 8 feet away from people, it is less likely that there will be transmission, obviously. But the best thing to do is, if you want to go boating, have less than half capacity in your boat and stay on your boat. That's fun. That's enjoyable. People enjoy doing that. We don't have to gather on sandbars because there are a higher likelihood, if you get a lot of people in a very small confined space, that if one person has it, you're going to leave there, 20 people are going to have it, and then they're going to go infect 5 to 10 people, and now, boom, you just went from 1 case to 300 cases very, very quickly.
So it's the clustering thing that still concerns you in that area.
It is clustering anywhere is what concerns me. It doesn't matter if it's in a restaurant, a bar, a grocery store, which we all have to eat, or if it's on a sandbar. The clustering is how community transmission occurs. Again, weddings, funerals, they're not advisable right now. And it's horrible. I wish it wasn't true, but that is what the health experts tell me, and they've been right every step of the way, and I absolutely am committed to trying to keep Mississippians safe.
I'm anticipating that some folks with those questions, particularly about weddings, with it being the season it is, may say, well, hold on a second. Churches are getting a guideline that they could be back at 50% capacity. Could I invite 50% of what I had originally planned in this church setting? What do you tell these folks who are trying to figure out what's next for them, maybe for a big event that they can plan and are trying to shuffle?
Well, I mean, I will tell you, I think to a certain extent, I can tell you what I believe is advisable and what I believe is not advisable. At some level, individuals are going to have to make their own personal decisions, and we are strongly discouraging large groups of individuals coming together, and that's the reason we have. I mean, think about this: there are 8 pages of guidelines for the safest way for churches to reopen. Okay, 8 pages of guidelines. You know, if you want to have a church service, probably the best way to do it is to do it outdoors. If you want to have a wedding, do it outdoors. Do it with individual chairs 8 feet apart, and spread out over a football field. And that's probably the safest way to do it. Again, does that mean it's safe? No, that means it's the safest way to do it. And so, I know people want to get back to doing what they want to do. They want to go back to the way it's always been. If we're going to work together to keep the spread of the virus from blowing up, which, by the way, is the absolute worst thing that can happen. You know, we've been consistent. We've reached 400 new cases in a day, but we know that basically the 2 times that occurred, we had really low cases either 2 days before or 2 days after. So that was really a data dump, probably. I mean, you start looking at the average number of cases, and it's been between 220 and 280 for many, many days on end. We don't want that to double. I looked at the numbers yesterday, and if you looked at the numbers yesterday, it had taken 23 days for the total number of cases in Mississippi to double. Well, what that means is, as I mentioned earlier, even though we've had 11,704 total cases, because of the time that has passed, 7,681 of those have recovered, which means the total number of active cases is closer to around 3,000. We have adequate, we believe, contact tracers and staff at the Department of Health where we can do the things that need to be done to slow the spread of the virus as long as those numbers stay at 3,000. If that were to double, because we had a really quick pop, because we had, say, one preacher, which we saw, one pastor at a funeral, for instance, infect 100 people in one community, unknowingly, I'm not intentionally, and I'm not being critical, it's just, if that happens 2 or 3 times over, then we find ourselves in a very different posture where we're having to play defense rather than trying to play offense.
Pretty much now it's entertainment venues, be it museums or concerts or movie theaters, and I'm not sure how many bars exist that can't serve food. I don't think there's. And then just refresh me, what is the guidelines on is there an executive order involving weddings and funerals?
There is no specific, and I'll let Dr. Dobbs mention this in case I get it wrong, but my recollection is there is no specific order that relates to weddings and funerals. There is a specific order with limiting groups for leisurely purposes indoors to 10 people or less.
Am I missing something that's still closed?
It's primarily entertainment, indoor and outdoor entertainment venues, and bars that do not serve food. We have limited the ability to have live music, and so, but we're looking at all of those things and trying to determine how we provide guidelines to make as many of those as possible safe also.
Any game plans regarding fall sports, like summer baseball season, move it into fall sports, and whether you can loosen the guidelines there or look at buckling down?
Yeah, in fact, we have increased the number of individuals that can be in any one confined space outdoors from 10 to 20. We still strongly encourage that these individuals maintain social distancing. I'll give you an example. I know specifically a team that is practicing with less than 20 people that are not providing group water, for instance. So everyone has to bring their own water, and they're keeping their stuff 6 feet apart so that we're not gathering up around the watering hole. So we are allowing them to practice now. I think as we progress through the next several days that we are all going to get more comfortable with loosening the guidelines to allow for potentially games. Again, confined a number of individuals, but potentially games going into June and into July. The fall, what I would say about the fall is that we are hopeful, though I don't think we have definitive evidence, that the summer is going to, the heat that comes with the summer is hopefully going to help slow the virus, much like it does with the flu. The flu is still around in the summer, but it's much less so. It's much less contagious, it appears. We're hopeful that that is true of coronavirus, but we'll see. But there is a lot of concern by our experts, and I won't speak for them, but also the national experts, that the fall could very well bring a new surge of cases in our state and really across the country. When you talked about, I can remember the conversations that we had very early on. Many of the projections in terms of total number of cases, total number of fatalities, et cetera, were assuming that this would be spring of 20, fall of 20, and then most likely fall of 2021 as well. And now, again, we don't know that's the case. We could get, we certainly pray that the summer heat comes and kills it and it never comes back, but I don't think many experts believe that is the most likely scenario.
Yeah, I'm jumping ahead, but if you do sign that bill, will you be prepared at that time to give people, businesses, a sort of a roadmap of how to proceed to, I mean, will it be that quick that you can start talking about?
We're certainly, we have large groups of individuals that have been preparing for weeks to find mechanisms by which we can comply with Treasury guidelines. And while checks are not going to be going out immediately, it's certainly we're going to get it done as quickly as is humanly possible. Seeing no further questions, thank you all for being here today, and we will see you tomorrow. As a reminder to those that are watching across the state, we will be back live at 5 p.m. today to continue our graduation. Congratulations. We have done over 4 hours of reading of names for the class of 2020. I know we have several hours left to do it. I'm so proud of the 2020 graduates, and it is my privilege to honor you by having an online commencement service. We did quite a few hours on Saturday, quite a few hours on Sunday, and we'll start back at 5 p.m. today. And also, I would encourage everyone to join us tomorrow at 2:30. I do think we'll have some big news to announce at 2:30 tomorrow that should be very, very well received by people throughout our state. So thank you.